They're called unsolicited reports, okay? So we look for doctor shoppers in the P&P, and once we find doctor shoppers, we report them over to whoever's involved. We also do schedule reports, all right? Top prescribers, right? Top 10 amphetamine prescribers, top 10 oxycodone prescribers, hydrocodone prescribers. And we send that out to the licensing boards. We also do reports generated by a complaint. You know, a patient may say, my son got a 30-day supply of hydrocodone from dentist X. I can't believe it. Why are they doing that? My son is going to abuse these medications, so on and so forth. We may then look at that dentist and then realize, whoa, they're prescribing a lot of medications. Why? If we feel that it is suspicious, we can report them over to the dental board. Reports generated from day-to-day abnormal findings. Just day-to-day, we find things that are abnormal or unusual. And if we do find that, we report them over as necessary. All right, once the licensing board gets that information, what do they do with it? What are they required to do? They're required to notify the licensee, all right? Hey, I received a report from the Board of Pharmacy. They must review and evaluate the information within. They must, check the P&P for relevant information. They may require to, they may require the licensee who's subject of the review and evaluation attest that he or she had complied with the requirements of AB 474. And they may request for additional information from you as a licensee. Tell me why you prescribed 30-day supply to all your patients, right? Why is it 30, are you making any changes, different clinical decisions based on your patient, or you're just, everyone gets 30 days hydrocodone? Tell me why you're doing that. Give me evidence that this patient has enough pain for you to prescribe this amount of medication. Whatever it is that they want, they may ask you. If after a review and an evaluation of the information, they do determine that you are writing unauthorized prescriptions or inappropriate prescription, they must proceed as if it was a written complaint, and then they must, go through the process of further investigation and really go through that investigation process. And then they can impose appropriate disciplinary action on their licensee. When deemed appropriate, the licensing board, they may refer out the case to other licensing boards as well. So if the pharmacy board is involved, we can take on some of that or visit the doctor's office with the dental board, all right? And they may also postpone notification, right? So if they think, oh, this doctor is doing something bad, they may postpone notifying you because they're gonna do an investigation. And right now, I don't know if any licensing boards currently have definitive disciplinary action if a practitioner were to not comply with AB 474. They already have disciplinary actions for a lot of things spelled out, and they may utilize that for AB 474. And I know the medical board's drafting disciplinary action for violation of AB 474 for their licensees. I don't know if the dental board is working on that, or if there's already some disciplinary action in place for certain violations that fit this. All right, and if the licensing board deems that you are a danger to society, that you are overprescribing so much that you put patients at risk, they may suspend your license, do a summary suspension essentially before you go before your board. All right, so I did mention that when we do unsolicited reports and we find a doctor shopper, we alert all the doctors involved with prescribing to that patient as well. Have any of you guys received an unsolicited report from us? Oh, wow, okay. All right, a few of you. All right, what did you do with them? Hopefully not just shred them. No, I hope you reviewed them. I mean, you don't have to tell me that you shred them. But hopefully you review the information. Hopefully it is helpful. The letter is not intended to tell you how to practice. If you read it, we're trying to be very gentle. Hey, you know, this patient may be doctor shopping, just letting you know. It doesn't mean you're under investigation. It does inform the practitioner that there's a doctor shopper. It reviews some of the AB 474 requirements and provides you registration instructions to the P&P if you're not currently registered already. And this is how a unsolicited report to a practitioner looks like. If you've received one of these, then it's probably because you have prescribed to a doctor shopper of some sort. All right? When you get this report, please do not fire your patient. These are your patients that need the most help. All right? These are patients that may be going down the wrong path. We hope that if you get the report, you review it at least and don't just shred it. Okay? Please review it. And the thing is, you may find out that the report, you didn't write any of those prescriptions. They're all fraudulent prescriptions. If so, then just report it over to the Board of Pharmacy, to law enforcement. Here are our contacts. Okay, if you report it to us, what we can do is disseminate the information out to all the pharmacies saying, this is a doctor shopper. These are fraudulent prescriptions they're writing. Don't fill for this patient for any prescriptions written by this doctor. Okay? If you review it and you're like, I did write that prescription, then you may want to assess whether or not that patient has abuse problems with controlled substances. You may, if you feel like they don't, you know, it was a legitimate prescription. Yeah, they got it from doctor 2 days ago, but they finished it because it wasn't enough pain medication. They were in so much pain. That's why I prescribed it to them. And you document it. It's no big deal. All right, so you can consider, you know, continuing the treatment. If you do see that, oh man, they got tramadol, you know, 11 times this month, maybe they do have a problem, you may want to discuss that issue with the patient. Look, I got this report. It shows that you got 11 tramadol prescriptions in the last month. What's your problem? What's going on? You know that this is illegal to do. What can I do to help you out? You know, or do you have, you know, a family practitioner that we can talk to about this? Help the patient out. You can always, if you don't know what to do, you can always refer the patient to addiction treatment programs, and here's a list of different sources so that you can refer the patient out. You can refer them to a pain management specialist. You can find pain management specialists at that website. And if you don't know what to do with that patient, talk to us, the P&P. Again, we have a pre-criminal intervention program where we can put the patient in touch with a pain management specialist, with someone that can treat their addiction. For resources. All right, so prescribe365.nv.gov has a lot of resources. It has frequently asked questions, FAQs. It has the informed consent, that template. You can modify it however you want to put your business on it, but it has all the different components that you have to address. Okay, the minimum, it has all of that. It has the compliance checklist, a white paper of AB 474, summarizes 52 pages into 4 pages. It has a sample medication agreement, sample prescription, CDC prescriber information, risk assessment tools. Very helpful. And the Dental Board website has a wealth of information as well. All right, so that's AB 474. I really just quickly want to touch on Senate Bill 59, which was also passed effective July 1st. It requires Schedule 5 controlled substances to be reported to the P&P. Before, it was only Schedule 2, 3s, and 4s that pharmacies had to report to the P&P, but now we have Schedule 5 controlled substances that must be reported, and that is to give you guys more information so that you can better have more information to guide your clinical decisions. All right, and then also with Senate Bill 59, law enforcement must also report to the P&P. So if they encounter someone who had stolen a prescription for a controlled substance, they must report that to the P&P. So then you will know John Smith stole a prescription for a controlled substance you know, a day ago, a week ago, a month ago. Maybe I don't want to prescribe to that patient. About an hour, a little bit over an hour. Any questions? Yes?
Do you have any information on the state of Nevada suing the drug manufacturers?
Any information on state of Nevada Suing the drug manufacturers, I don't know for sure. But I know a lot of states are pursuing that, and they're getting some money so that they can start drug treatment programs. But I don't know where we are in the state, but I believe we are doing that as well, but I can't confirm. Yeah. Any other questions? Yes.
If you're delegating this to one of your staff members and that staff member leaves, how can you remove that staff member from having access?
So the question is, if you already have delegates, if you delegate a staff member to pull reports for you and the staff leaves, how do you remove them? Contact us, we'll remove them, and so you can add another delegate. Yes?
You have a handout for this sort of thing with all this writing for our office.
Like this handout? I can email it to your president, who can disseminate it out to you. Yes.
Can you post it on our SNDS website?
I can't post it personally, but if you can. Yeah, yes, of course. Yes. Any other questions? Yes.
Just clarification, when you're saying best faith effort to contact the medical history, and you gave the example, like if dentist retired, so try to use that dentist record.
Mm-hmm.
So we don't have to contact the physicians, is that what you're talking about?
You just have to make an effort to pull their medical history. You know, whatever that it is that you need as a dentist to make your dentist prescribing decisions. So you may not need to know that they had a mastectomy, 10 years ago, because that may not influence how you prescribe to the patient because it's not dental related. It's what pertains to your scope of practice.
So it has nothing to do with the drugs that they're taking. So they
Mhm.
could have got pain medication for that mastectomy.
Mm-hmm.
You don't have to contact them and track down their history that way.
So the law does not specify to what extent and to whom you must get all of the history. So it doesn't say that if you're a dentist, you must get their PCP and their endocrinology history, and yeah, it doesn't specify that, unfortunately. Hopefully with some regulation it can clarify that so you know exactly what you're having to pull.
So the question is, until we know
Mhm.
exactly what the law means,
Mm-hmm.
I would say you have to get medical information because that's what's going to, I mean, whether the guy had a root canal doesn't matter. I mean, it's the medical issues that will sway you from prescribing another, right? It is such a base.
So you call, so if you have to track it down, say you call the doctor, he's out of the office. Or
Mhm.
can't.
You made a good faith effort.
Go home, I can't prescribe this to you.
No, it doesn't mean you can't prescribe. You made a good faith effort to obtain it. The doctor's office is closed, and so you made a good faith effort. If the patient needs it, you feel that the patient needs it, you can prescribe to the patient. You have to document your good faith effort, though. So if you say on the patient's chart, I may call the doctor's office, not open, made an effort to obtain the medical records, the patient still needs pain medications, I'm going to prescribe. Yeah. You first.
800 milligram Motrin, you still need to go on PMP and look up that patient.
So the question is, if I prescribe 800 milligrams of Motrin, do I have to check the PNP? No. This is for only, a lot of this pertains to management of pain, prescribing controlled substances for the management of pain. The only parts that don't, that actually apply to all controlled substances is checking the PNP. So even if you are like a psychiatrist and you prescribe a lot of ADHD meds, you still have to check at the PNP when you write it and every 90 days. Okay, and also the different components, right? There are about like 9 different things that you must evaluate for if applicable. Those apply to all controlled substances, but everything else, informed consent, patient risk assessment, all of that only pertain to controlled substances for the management of pain. So if you're prescribing amoxicillin, Motrin, those things aren't controlled substances, even though they can be, like Motrin can be utilized for pain, this doesn't apply to that. You first. Uh-huh. Mm-hmm. Mm-hmm. So the password security, we changed it so that, okay, so I just want to give you an explanation. We use a vendor that has an off-the-shelf product. It's called Appriss. They actually service 40 other states. So 40 other states utilize the same product. Anyhow, for the password reset, we changed it so that you only have to change your password every 6 months instead of every 3 months now. And a lot of times you're typing in, I'm not accusing you of anything, but you may be typing in your email wrong, therefore you're not getting the password reset email. That's usually when we troubleshoot, that's usually the case, because they'll call us and say, oh yeah, I'm using my UNLV email. Oh, but you register under your Gmail. Oh, that's the problem. Then they type in the Gmail and then they get the reset password. Yeah. Okay. Uh-huh. Mm-hmm. Yes. Thank you. I'll take that feedback back and I'll see what I can do with my vendor. But if this website is down and it doesn't work, you're not responsible then. So if you document website is down, could not query patient, that's sufficient. You've met your duties. Because there are time frames where it is down. It doesn't mean you can't prescribe to your patient just because you didn't check the P&P. You made a good faith effort, and there's a law that actually protects you from that. Yes.
Do we follow the same protocol for anti-anxiety meds as well?
Anti-anxiety meds, if you're using it to treat pain, not likely. You wouldn't follow the same protocol. You would have to check the P&P though, but you won't have to do an informed consent, or you wouldn't have to do a patient risk assessment. You just have to query the P&P and then evaluate for those 9 items for all, but you probably are doing it already. Yes. Mm-hmm. Okay, so did you contact the, okay. Uh-huh. So we work on a lot of those cases where a patient may have filled a prescription under your name. It may be fraudulent, or the pharmacy made a mistake and picked your name instead of the correct doctor's name. So what you do is, obviously,